In this tutorial, I'm going to show you how to do a full travel consultation with the patient. So this is one I've set up earlier. I'm going to go ahead and start the consultation. I can choose what kind of consultation I want to do with this patient, and in this case I'm going to do a full travel itinerary. So Inca Clinic uses the idea of care pathways. A care pathway is a series of steps that you can join together to form a consultation. So you have complete control over what steps are included and what order those steps present themselves within a consultation. If I want to look at the patient's details in more detail, I can just expand this, and if I need to, I can update that if something's inaccurate. Down here, I'm on the travel itinerary step, so I'm able to capture some information about this patient's planned itinerary, so I can go ahead and set up some dates. Oftentimes with business travelers, that may not be the case, so I can choose an unknown duration. But in this case, it's a fairly straightforward trip. They're going out for the end of April, and we'll just enter that they're going to Thailand, so I simply type that in, type that they're going for 10 days. And if I want to, I can add a further country into that. So we'll just put in Cambodia as well as part of the trip, and they're going to go there for a week. As I enter this information, you'll notice that profile information for each of those countries appears, and I can access that country profile on NAFNAC or CDC or whatever other resources that are available and that I like to use. So just flick back into our consultation again, and what I can do here is just set up what they plan to do while they're overseas. And again, this is something that you can set up, edit, and add a risk weighting to. So I'm happy with my consultation, just press save. And I'm ready to go on to the next step. So here I'm going to just capture some medical history about this patient. As this is a female patient, it's going to ask me to confirm their pregnancy status, which I'm going to do right now, and that will add that to the patient's medical history. I can now add in other medical conditions that the patient has, or I can go ahead and do a health assessment. And again, these are questions that you can set up and configure. Typically they're a yes/no response, but they don't have to be. So I'm in good health, I'm going to say yes. I can list any medication that the patient has. If I say I don't have any allergies, that's fine. But I might indicate that I have asthma. And in this case, what I can do here is put in a note if I wish, or I can flick back to the specific medical term and add that to the list as part of the patient's medical history. The reason you want to use this is because these terms can be linked to vaccines on the scheduler and highlight any possible contraindications with a particular vaccine. So I flick back to my health assessment and just complete that and press save. So I've now done a risk assessment for this particular patient and recorded some medical conditions related to that. If the patient had previously attended, any past medical history would also be listed here. Finally, if I wanted to put in a note because it didn't quite fit into any of the other categories below, I can just put in some kind of note about this patient's visit, and this is available throughout the consultation, so I can update and append that as I go along. The other thing you'll notice is that it also highlights what I've done so far in the consultation. So again, saving me the trouble of having to navigate back to previous steps. So now I'm going to go on to the vaccination history step. And these three are really paired together: vaccination history, scheduler, and administration. Here I'm concerned with the patient's past vaccine history. So I'm just going to go ahead and put in a very simple example of someone who has claimed that they've had tetanus sometime in the past. They're not quite sure when, the last 3 or 4 years. So we're just going to record this as verbal information. So we're not quite sure how accurate the information is, but nevertheless we record it as part of the patient's record. More extensive tutorials on this particular feature are available on our YouTube channel. So once I close that down, you'll see that this has updated the patient's record to show that they have some level of cover, or at least reporting some level of cover against tetanus. When I move on to the next step now, it's going to present me with the vaccine scheduler. So this is where I plan what vaccines I want to give to the patient. If I want to, just click this little alerts button and I can go off and again just check WHO, CDC, NAFNAC, or whatever resources you like to use, and just check what their policy is on this particular area. You'll see that, for example, yellow fever has come out as checked as required. And if I mouse over that, it just indicates that Thailand has some kind of entry requirement. It's not saying I need the vaccines, it's just simply saying I need to go and check what the policy is for that particular destination. To schedule a vaccine, then I just click on it, click add, and again you can set what default vaccines you'd like to use. So if I don't have Typhorix in stock, I can scroll down here and choose Typhon Vi or what other brand I have available in my clinic. So I'm going to go ahead and line up Twinrix, and you can see now I have a choice in terms of what schedule I want to use for this patient. Inca Clinic comes with about 40 vaccines already preloaded onto the system. You can change these, get rid of them, put in your own, and you can also adjust the types of schedule. So if you want to use some off-license schedule, you can easily add that into the system. So I'm just going to use the primary schedule. Going to click on Revaxis, and you can see now it's indicating that this patient claims to have some kind of cover against tetanus. Maybe it's about to expire quite soon, and we decide to go ahead and give the vaccine to the patient if we wish. One of the important designs within Inca Clinic is it doesn't tell you what to do. It simply gives you guidance and lets you make your own clinical decisions in terms of the patient's care. So we'll go ahead and we'll put in rabies for this patient. So I'll just put in a 021 schedule. And you can see up here we've kind of built this plan in terms of what vaccines you might want to give to this patient. So I might want to make some changes to it. That schedule is a bit inconvenient for the patient. So if I wanted to and it was appropriate, I could change that so he comes in for, or she comes in for her Twinrix and rabies on the same day. If I decided actually I want to change that back, I can easily change the schedule and manage it. These aren't prescriptive, so if the patient, this is just a plan. If the patient doesn't come in on the 20th, it's the 21st, the 19th, you can still go ahead and administer the vaccine without rescheduling. This simply is a guide as to the ideal dates. And again, if they are well out of kilter with the actual plan schedule, you can go in and edit it as appropriate. So let's just move that back to there. We've decided now that I'm happy with this. I'm just going to press save, and my schedule is now saved for this particular patient. So next step is to go on and do the administration. So what will happen is it's already queued up all the vaccines I've just scheduled today. And if I go and look at this plan, you can see this little red box indicates what is due to be given today. And here's my future plan. And it works kind of like a conveyor belt or a production line. Once these are given, the red box will move on to the next date that's in the schedule, and these will be queued down in this list below. So just hide that off. Just to orientate you around this, here we have each of the vaccines that have been planned for this patient. Here are the current batch numbers. As you can see, I can have multiple batch numbers in use at the same time, or I can add one in if I need to. If you're using Inca Clinic across multiple locations, then the batch numbers are filtered by that particular location, so you don't see a batch number from a clinic that's on the other side of the city or the country indeed. To actually line up my vaccines, I can either just click this add all vaccines at one time, or I can drag and drop the vials to the appropriate place. The important thing here is that what we're actually doing is planning the site of administration for this particular patient. Once I'm happy with what I'm about to do, I physically give the patient the vaccines at this stage. And the reason I do that is if they did feel faint, then I can just record that I gave the rabies shot and that the other three I'm going to cancel right now and give them on at a later visit. So once I'm happy and the patient has taken the vaccines, I can just confirm that. It just double checks the batch numbers. I click OK. So this is going to record the site of administration. It's going to record the batch numbers I use. It will take these vaccines out of your stock and also put them into the invoicing system. So this one button does an awful lot of things within the application and saves you a lot of time. So next two steps then are the prescriptions. So I'm just going to click on that, and again I can choose to put in some maybe malaria tablets or some other types of tablets or medication that the patient may need for their trip. Again, you can set this up and align it with the medication that you use within your clinic. Depending on what kind of dispensing policy you have, you can either issue a prescription at the end of this consultation. You can simply just record that you've given this medication, or if you actually dispense from your clinic or your pharmacy, then you can have this added automatically to the invoice. So it really depends on how you like to use it, but the system is quite flexible in that regard. So again, I'm just going to save this, and again, any previously issued medication will be listed on this. And in this consultation, I also have a lab orders test. And what I can do here is I might want to order some, maybe a blood group for this patient. Maybe they're traveling overseas and they want to have that information. But again, you can set up your own labs, save those. We can customize the system so you can get alerts to say a blood group has been ordered, and then you can record the results of that test at a later date. So now I've finished my consultation, so I'm just going to press the Finish Consultation button. And what this does is it will bring me to a summary screen, which will just indicate what we did in the consultation today, and lets me set up a few things for the next visit. For example, I might want to send the patient some health advice information. And again, you can set up your own library. It could be your own PDF documents, links to your website, or public sources such as NAFNAC, as you see in this example. And what I can do is I can just email that to the patient, and they will get a list of all that kind of helpful, all these links, any PDF files, whatever it is, will arrive in an email to them. And it also records that you did actually send that information to the patient. If I'm printing my prescription, I can use this option, print it out, sign it, and they can take it to a local pharmacy if that's appropriate. I can set up a template, so if I'm dealing with a family, I can reload the trip itinerary, so save me putting in that information again. I can give the patient a summary of their visit, and importantly, I can generate reminders. And what this does is it looks at what vaccines are due next, and allows me to make some changes maybe to when I want the reminders to send out, or I can just accept the automatic one, click generate, and that will queue an email to go out to the patient 4 or 5 days before the next appointment and remind them to get back in touch with you. So my visit is now done, and I'm going to save and go to the waiting room. And at this stage, I could get on with the next patient, or I could generate an invoice for this patient, and that will complete their visit to the clinic.